My daughter's Elena. She was a happy child. She was always talked about being a lawyer, but never showed any interest in law. She was very creative and liked to draw and had a wild imagination. When she was in college, we knew something wasn't right, but I wasn't certain what it was. She was experiencing a lot of anxiety and not dropping classes and just struggling to finish anything, changing majors a lot. And she was having a lot of medical problems, which at that point we didn't know that it had anything to do with drugs or alcohol, because she had had medical problems in the past. I don't know that I was really good at recognizing that it was an addiction, but I know the Christmas before she went into treatment, she was very late showing up for a family gathering, and she showed up in disarray, and it was a mess, and something wasn't right. But all of that was foreign to me. You know, I didn't go away for college, so all of that, I never experienced that kind of, you know, the college life. So by the months after Christmas leading into the summer, she was spending significantly more money than normal. ATM withdrawals at odd times. It was becoming excessive. I know I was very stressed because I never knew where she was or what she was doing, but I would call her every single morning to make sure she was up and getting some, you know, to work or school, wherever she needed to be. There was a lot of pressure because you didn't know if she was okay or if she was eating or if she was even doing what she needed to do. So I think there was a lot of anxiety and stress.
I grew up in a normal family. My grandfather was an alcoholic though, and I played outside, I went to school, I did well in school, and then we're from a very small town, so drinking is very prevalent. So there's lots of drinking, you know, you cook and you drink, and you go to the camp and you drink, and so we just started drinking. And then I just added in everything else. Started taking pills, started smoking marijuana, and it just built on top of itself. When I moved away to college, that's what I did. More than class was go out and go drink and use drugs and all of that. And so it just continued until I finally was going to die if I continued to do it anymore. I hit rock bottom when I was about 24 years old and my liver was failing. I had 2 hernias. My insides were shutting down from chronic alcohol and opiate use. And you know, the doctor told me that if I didn't stop, I was going to die. And that didn't really stop. It was just kind of this internal thing. I had a moment where I realized, like, I don't know where my life is going, and I don't, like, what is my life? What is this that I'm living in?
Her house was a mess. They were, you know, not cleaning it, didn't want me to clean it for her. When I took her home from the outpatient procedure, she had enough painkillers for 1 or 2 days, because that's all you would need, and she was very upset that that wasn't going to be enough. That was at the end of June. The weeks after that, the withdrawals were excessive, overdrawing her account, till finally I said, I don't know what you're spending all this money on, but if you overdraw the account, I'm going to have to close it. I have to close it. I can't afford you to spend all this money. And she said, but I need my medicine. And she says, well, I need my medicine. I told her, there's no medicine you need at 10 o'clock at night that you're going to pay for with an ATM withdrawal. And if that's what you believe, something's wrong, and you're going to have to find a professional, because I don't know how else to help you.
My mom confronted me about the amount of money I had taken out, and I didn't lie to her. I just said, I've been using drugs, and I don't know how to stop. And she said, well, you need to find somewhere to go, because I can't help you anymore. And so I Google searched rehab Baton Rouge. I found somewhere that turned out to be a men's facility, and they said, well, we have the number to a women's facility. And I called them, and I went in the next week.
And then the next morning, she called and found the journey home, and called me at work and said, I found a place. I said, okay. She says, it's $6,000. I said, okay. And I went home at lunch and told my husband, and we brought her that Monday.
I went to treatment at an all-female inpatient facility, and I was there for 22 months total. I got introduced to 12-step programs. I did a lot of one-on-one and group therapy.
We weren't allowed contact in the first few weeks, so I don't know how that went, but after a few months, she blossomed in treatment and embraced what they were teaching her. I'm sure there were some setbacks along the journey, but she did really well and told us she wanted to go through the entire program. So we let her stay till she graduated 22 months later.
I worked through all of this stuff and worked on living skills. You learn to live without drugs and alcohol. It was a really good experience. I made some really great bonds with other women in recovery. I learned how to live sober and live in recovery. And then whenever I got out, I started, going to 12-step meetings and just living those principles that they teach in it and applying that to my life, and also building my life in recovery, being a student, a normal, productive member of society, which I never was whenever I was drinking and using.
Today she's doing fantastic. She is back in school, making fantastic grades. She's got a beautiful 2-year-old daughter. She's living in Baton Rouge. She's got a large circle of friends. We see her often, and she's full of joy and happy. And
over the last few years, I became a parent, and I'm getting close to the end of my school. So just building a home and being a mom and being a daughter and sister and grandchild, being a part of my life and being a part of my family's life and my friends' lives, and being there and being able to be completely present for my daughter. It's really amazing. It's something I never thought that I'd have.
Louisiana is in many ways no different than the rest of the country. We are also experiencing what has been called the opioid epidemic, which means we are seeing an increased death due to overdose and the use of opioids. We're seeing increased utilization, and then because of that, an increased focus on recovery and recovery services and substance use disorder treatments. Louisiana Department of Health, Office of Behavioral Health, is attacking this in a multitude of ways. We've been fortunate enough to receive a lot of federal grants, which we've used to focus on a couple of different things. Prevention, trying to prevent people from ever starting to use substances, but also increased treatment and recovery resources in a couple of ways. We're hoping to expand access to treatment providers through the use of our grants. We're also hoping to increase the number of people receiving treatment by paying for people who are uninsured. On the Medicaid front, thanks to Medicaid expansion, more people are able to access substance use disorder treatment services due to involvement in managed care and integrated managed care in 2015, as well as some CMS, some federal Medicaid authorities and waivers. We've been able to offer the range of recovery services called the ASAM levels. So right now for Medicaid, Louisiana covers all ASAM levels. One thing we're really looking forward to coming up probably in calendar year 2020 is the coverage of methadone as well in the Medicaid benefit array. We're definitely seeing more people access treatment thanks to the efforts that we're putting in. More of the uninsured population accessing treatment, definitely more of the Medicaid population accessing treatment.
We have seen success with some of our pilot programs that we're offering here in the state of Louisiana. One of our pilots is geared towards persons that are incarcerated. And what we're doing is providing treatment services, evidence-based services such as medication-assisted treatment within some of our prisons across the state. And basically this form of treatment is providing medication and counseling simultaneously to help impact the recidivism rates within prisons. Because as we know, once a person leaves prison without any treatment services available, the recidivism rates are much higher. So what we're doing is providing those services while they are incarcerated, and when they transition back into the community, we're also continuing to provide those services for them.
This effort's important. It's a national effort as well as a local effort and a state effort, because people are dying. People need services. People need to know how to access services. And then once they receive services, I mean, recovery is a lifelong journey. So we need lots of different types of services and levels of services in order for someone to assist someone in maintaining their recovery.
It's important for persons that are incarcerated to receive treatment services versus just purely incarceration with no type of therapeutic services. With persons with substance use disorders incarcerated and receiving therapeutic services, their probability of recovery is much higher.
People can and do recover from a substance use disorder. They can live clean and healthy lifestyles. Sometimes it takes a couple of return to use before they kind of maintain that road to recovery. It's constant. It means different things for different people, and everyone kind of finds their success in a different way. But we are absolutely seeing people who've been addicted to opioids and other substances that have gone into treatment. They've turned their life around, and they're now leading lives without addiction. I am encouraged by the trends I'm seeing in this area. The trends aren't just about the numbers of people getting recovery. The trends are also the focus on quality treatment, the focus on a different arrays of treatment, because everything works differently for people. Some types of modes of treatment that work for one person doesn't work for the other. Therefore, we need a very robust and full continuum of services, different types of services, and that has been a big focus. I'm encouraged by the trend of simply highlighting the issue and local communities galvanizing around this issue and doing what's right for their local community versus a one-size-fits-all. But then, of course, most of all, I'm encouraged by the numbers of people receiving treatment. Due to many different things, we're seeing those numbers increase.
It's very early in our project right now, but I do know there are some success stories out there. What we know is that persons are receiving treatment, persons are in recovery while incarcerated, they are receiving medication, they're receiving counseling services, and they are successfully transitioning back into the community, continuing to stay in recovery, continuing with their therapeutic services, and a safe recovering environment. So we're very pleased that we have been allowed the opportunity to receive a couple of grants here in the state of Louisiana, and those grants are particularly helping us to reach more people. They are helping us to expand our capacity and expand the network and access to care so that more people can receive treatment at the time of need, at the right place, within their communities.
I am a junior at Southeastern Louisiana University. I am an early childhood education major, so I will be certified to teach pre-K through third grade. I plan to graduate in December of 2020, I believe, yes. And then I want to teach kindergarten. I'm not sure exactly where yet, because I haven't decided if I'll move closer to my hometown or if I'll stay around this area, but my goal is to teach kindergarten, just help mold the tiny humans.
My advice to other parents is don't be afraid of sending them to treatment. Don't be afraid of forcing them into some long-term facility, because they need to relearn how to live, not just get off of the substance that they're addicted to. They relearn everything. And in the process, you relearn it too. Because even though I never sat through a real therapy session, I think, through all our update conversations with the medical staff, I believe they give us therapy too.
My advice to others facing addiction would be to not give up hope that there is a way out of it, even if you feel like you're at the end and there's no way that you could ever get out and there's no hope at all. There is. If you're still alive, there is a way to get out of it, and it's possible to have a full, complete life no matter what.
People can get more information about substance use treatment through the Louisiana Department of Health website. We have website links, we have phone numbers. Also in their local communities, they can go to their local Human Service District or Authority or LGE. We also have that contact information on our website as well.